Hey guys, I'm going to go over grading today, assuming that we already know we have periodontal disease in this patient's mouth and we've already staged the patient. Grade A, B, or C are the three categories you can put as a part of your diagnosis to see what kind of progression the disease is. So say the patient doesn't have any kind of smoking history or no HbA1c, so no diabetes, then we can look at the bone loss and how it's progressing over the 5 years. So the first criteria you can look at is the bone loss over the 5 years. If there's none at all, it would be a grade A. If there is bone loss less than 2 millimeters in the past 5 years, then it would be a grade B. If it's more than 5 millimeters, if it's more than 2 millimeters in the past 5 years, then it would be a grade C. Another cool way to using this, there's a math way, which is super simple. I know nobody likes to do math, but it is a simple calculation. So say we have 10% of bone loss. So this is the bone loss. And then we divide that by their age. So say this patient is 35 years old. So this is the age, and it equals about 0.28. So what does this number mean? There's an actual in the chart with the 2017 classification periodontal chart. There is numbers right below that says it's indirect evidence. So direct evidence would be the priority to use, and then indirect evidence is right underneath, and you can use this to identify if it's a grade A, B, or C. So grade A would be in this number if there is that number less than 0.25. If this number calculation is between 0.25 to 1, then it's grade B. And if it's greater than 1, it would be grade C. So in our example with this patient, it would be considered a grade B. So that one would be a grade B. But if we say we'd had a different, let me just erase this, and we changed the age. So if we had an age, I don't know, 80, let's see what that would change it to. So 10% divided by 80, I'm just going to do it in my calculator. It's 0.13 if we round. So that changes significantly. That means the progression, 10% bone loss, and you're 80 years old, that's not going to be a very high rate. And that's because the age, it's more of simple algebra. If you increase the denominator, it's going to make it a smaller number. So that's why it's a grade A. Okay. So if the opposite happens and you increase the bone loss, decrease the age, obviously there's a more rate of a progression and the disease is more severe. So this is just looking at the grading process. If we're aside from HbA1c or smoking, that's a whole nother realm of categorization. So if the smoking, if you are looking at smoking, if they're a non-smoker, then it would be a grade A. But you also have to look at all this bone loss. If there's a complexity factor of smoking more than 10 cigarettes a day, you would have a grade C. If it's less than 10 cigarettes a day, then it would be grade B. So that's just smoking. HbA1c, if it's uncontrolled diabetes, then it would be C. If it's controlled and it's HbA1c is less than 7, then you would rate them as a grade B. And if they're non-diabetic, it would be grade A. But again, there's so many different factors that you have to play into this. So if they have a lot of bone loss and their age is very young, you would need to look at that priority first, because based on the new grading and staging, you need to look at the direct evidence of progression, which is the very first line in the chart, and that states the radiographic bone loss or CAL needs to be used first, and then you can use the rest of them later if you don't have that or something with your periodontal charting is not complete. But I hope that helps with categorizing them, makes it a little bit easier to identify. Thanks and have a great day.